So, hi everybody. So, hope you enjoyed the day. We still have one presentation more. It's from a very good colleague, Natalia Bittencourt from Brazil. Unfortunately, she cannot be here. She will explain in the video, and she will present herself as well. I will say Natalia is really an inspiration for all sports PT worldwide, especially women's sports PT. She is great clinician, great sports PT, great researcher, manager, entrepreneur. She has a position of head of performance and health at Esporte Clube Bahia. It's a professional football soccer club in Brazil. It's the first woman, first lady ever to hold this position. And we are just happy that she was able to do the video for us, and then she will be live online on Zoom for Q&A.
Hi, everyone. Nice to meet you. I'm really happy to be here. My name is Natalia Bittencourt. Thank you very much, Mario Bizzini, for inviting me to this very important conference. And I know this is one of the best in the world, so I'm really honored to be here and to talk about this exciting topic, which is reducing muscle injury in team sports. And of course, I will bring to you my experience here in Brazil. So right now, I'm working a lot in football. So I will present to you my experience and how I'm bringing some science to the sports context and football context. So I hope you enjoy my presentation, and I'll be here to talk more about the topic, discuss, and also to have a lot of questions, and maybe we can enjoy a lot. So thank you so much, and I will start the presentation. So before we get started, I would like to introduce myself and talk a little bit quick about my journey in sports. I'm a sports physiotherapist, but before that, I was a volleyball player, and I had an ACL injury when I was 17 years old. So when I decided to stop playing, I decided to study sports physio, and here in Brazil, it's a graduation of 5 years, so it's a full dedication in studies. And so I did my PT, my physical therapy graduation, and also my master's degree, my specialization in PhD in UFMG, which is the Federal University of Minas Gerais, is a very important state here in Brazil. And I finished everything in 2015. So I'm very proud of my academic journey. And also I've learned a lot. And one of my goals there was to bring science into the sports and bring science to sports physio too. So my whole journey, my mission in this world is trying to improve the way we can work, and also in an easy way that all the physios can use science and technology in a quick way and an easy way in the daily basis. And after that, and during this process, I was working with the national volleyball team. So it was a dream that came true. So I'm really proud of that. And during 15 years, I worked with more than 1,000 athletes from 8 different sports modalities at Minas Tennis Club, which was one of the most important clubs in Brazil. It is one of the most important. It's a very big and large sports center. And I've learned a lot and apply a lot of everything I've learned into that. So I'm thankful and grateful for this beautiful journey that I had at Minas Tennis Club. And also everyone knows me when I put this image, because it's one of our famous paper and about complexity and how can we understand injury having complexity science behind us. So today, it is one of the 50% top papers from BJSM, and I'm very proud to be part of this sports medicine paper, sports medicine history. And also, I am the first Brazilian sports PT to be part of the IOC prevention conference. So I'm part of the scientific committee it will be my second year in the scientific committee, so I'm also really proud. And I was part of the FIFA consensus last year, so also I was the first Brazilian PT to participate in this very important scientific topic. And finally, I helped to develop an application which calls FAST, is a physical therapy assessment tool, and we are very proud of this product because we can assess in a very organized and scientific way. So I invite you all to download the app, which you can download in Google Play and also Apple Store. So feel free and enjoy us in this nice journey to have scientific and technology into the physiotherapy routine. And the last thing is that I am the first Brazilian woman PT to lead performance and health team, a multidisciplinary team in football here in Brazil. So also this is a big achievement for us as a physiotherapy and also leading doctors, nutrition, strength conditioning. So this is a trend here in Brazil. So today we have almost 50% of all the Brazilian clubs having this performance and health multidisciplinary team. And we are really proud to have this today because it's a change in the way we are leading the performance and health in football. So I'm really proud to be part of this history too. So this is a little bit about me. So thank you so much for your patience to listen, but I think it's important to have this overview and how I'm doing all the science and all the practical around reducing sports injuries. So when I think about reducing muscle injuries in team sports, I have 3 pillars that I have in my mind when I'm doing that. So the first one is to have a very structured musculoskeletal assessment, and of course to address individual needs. The second one will be football context, which means that we need to be attention with the calendar because we need to know the full season and how can we plan the whole demand, sports demand. And also we need to talk and have a great communication with coach staff. And the third important pillar is performance and health monitoring. So today we are doing a lot of this, in last year and the year before. We are doing a lot of match day +2 assessment, musculoskeletal assessment and sports science assessment. Also doing some sprint vaccines to our players to reduce muscle injury, and also strength microdoses related to the sports and match. And we are doing this in a planned way that we can still, despite a lot of games, we can do strength in a microdoses planning. So we are doing this pillar for the last 4 years. And we, of course, have the main challenge to do tailored solutions and in a process that we can learn from our mistakes and reflect and rethink and replan. So it's important because it's a very dynamic process that we need to be active and proactive all the time. So when we are thinking about sports demand and football demand, we have to think, and this is a very important slide because the sports lead to physiological stress and also biomechanical stress. So if we could split into 2 different words, will be like metabolic costs related to cardiovascular cost and demand, and also joint muscle and tendon load. So we need to be aware of that because it means that the muscle and the tendon will adapt differently from the physiological usually response. So we know that biomechanical adaptation tend to have a slower response rate than the physiological adaptation. So this is a very important point because sometimes we only see and we only assess the physiological change, and we forgot to assess and to monitoring how joint, muscle, and tendon. And of course, the technology will help us to improve these in a daily basis. But I'm going to show you how we are doing that to decrease muscle injuries. So there is a mismatch between physiological and biomechanical adaptation. So I love this draw because it looks like the physiological adaptation is in a fast way, and unfortunately, we have the biomechanical adaptation in a very slow rate. So it's important to address that, because regarding the muscle, we need to know that there is sometimes 72 hours to the muscle be stronger again after a soccer match, for example. So if we realize that, it's important to understand that the next sport load arrives when the tissue is still weakened, or of course the muscle or the tendon. And there is a gradual degeneration, and maybe the tissue will fail. So if we think about it, it looks like almost the most muscle injury will be like a chronic injury, because they will have this overload over time, and then one day we have the tissue failure. So we have two different possible solutions. The first one would be sports load should be reduced, allowing the tissue supercompensation, but sometimes we cannot do that because in 3 days we have matches, so it's impossible to do that. Or we can and we should increase tissue capacity. So this is a very, very important topic, because this is where the physiotherapist gets in the movie. How can we act, and how can we help coaches and players to be more robust physically? So I'm going to show you how musculoskeletal assessment can help us to increase tissue capacity. So we know, and we have this injury definition from the BHMS IOC consensus, injury consensus, that tells us that that an injury is a tissue. It's a problem that happens when we participate in sports, resulting from rapid or repetitive transfer of kinetic energy. So we are talking about energy. So this is important. Notice that if we are talking about mechanical energy, we need to understand which is the weak link of our musculoskeletal system, of our kinetic chain, because of course I'm going to do an example about the hamstring that makes the hamstring weakness, and how can we why he's getting injury. And this is important because it's a very important point for the sports physio. We must assess in a very, very strategic way, understanding the biomechanic behind everything. So I'm going to show this video again. So for example, if you have a situation in a fight sports, maybe the knock, it's not maybe, no, it's, you can see in the video, you can see that the hands and the arm movement begins in the foot. So it's travel around all the musculoskeletal system, and the kinetic chain is responsible for the energy transfer. So this is why we need to look overall and have this musculoskeletal global assessment and also local assessment. So I used to say that we need to have this global and local analysis to understand how the muscle and how the joint are working together in a synergical way to flow the mechanical energy. So when we are talking about muscle injury and hamstring overload, I always think about hip power, dorsiflexion, because with dorsiflexion, we will have elastic energy to flow over the system, also foot strength, and also trunk stability. So we cannot only think about the hamstring, but also the whole kinetic change that will transfer the energy, the kinetic energy. So this is a key point, because when we have this in mind, we will do a musculoskeletal assessment more effectively to understand the weak link, and also how and what we should do in a preventive way. So during sprint and during running, there is key musculoskeletal key points that enhance, that improve the performance around the hip and the foot. So we already know that the hip extensors are better when we strengthen the hip extensor, we will do better sprint performance. So the gluteus are very important in the triple extension, and the movement during the sprint movement. Also, we have the hip joint is important to dissipate the ground reaction force. And also, we saw in the different papers that gluteal warm-up could effectively enhance peak power during counter movement jump. So this key point during the musculoskeletal analysis will help us to understand how can we flow better this energy throughout the lower limb. And finally, there is some studies showing that foot muscle strength help sometimes increase horizontal jump and also change of direction. So we cannot forget our foot and strengthen the inner muscle around the foot. And this is really important because sometimes footballers, they don't do nothing for the foot. They forgot everything about the foot. So we need to, as a sports physiotherapist, to show this importance around the preventive program exercise. And finally, of course, we use in a very structured way, we use the FAST app that we can do the muscle assessment in a very technological way, because the app we will input the number and we will input the degree around dorsiflexion, strength, stability, mobility, and also strength. And we do in an automatic way the analysis if the player is better or worse than the trigger point, the value that it's the reference for them. So it's really fast because we can see the results, the final results in a very easy way, and show to the player, show to the coach, to strength conditioning coach. And using the assessment, we can know exactly what the player needs to do. Because, for example, if I want to do an individual intervention, we have to know that for the specific player, the dorsiflexion matters. But for the other one, the dorsiflexion is good. So this is why we need to do an individualized musculoskeletal assessment. And of course, FAST app can help us a lot doing that. So the second pillar will be foot-bone context. And it's important to notice that here I put three important things that are in my mind and my planning during the program to reduce muscle injury. So the first one, it's athletes buy-in. Of course, we need to educate them to understand how can they recover better, and also how can they be open to do the assessment. So this year, for example, in the beginning of the year, all the players are complaining about getting assessed, but right now no one's said nothing, and they are really interested in understand how their body responds to the match load. So right now we are navigating really good in this situation. And the second thing is planning the microcycle. So we need to understand the load in that week, and also the relationship between that week with the last 4 weeks and the upcoming next 5 weeks. So this is really important to get to know the whole context, to understand how the load we will distribute along the calendar. And also, of course, load distribution overview. So we must work together with the sports science to understand which player is having more load or less load, and we need to increase and improve the load distribution in a very balanced way during the whole week or the whole month. And finally, we must improve our communication with the coach. So I know that sometimes we don't learn how to communicate better, but I think communication is the key point that we can increase the relationship between the coach, the strength conditioning coach, and how PT can help reducing muscle injury. So we cannot stay in our box. We need to communicate, and we need to interact between all areas, because having complexity in our minds, we know that sometimes the response and the key point is not in our area, is the combination between different areas and different points among all the football contexts. And the third important point is the performance and health monitoring. So it's really important for us to understand that we have a lot of factors around muscle prevention, but of course we need to translate all this information and all these risk factors to an individual injury risk profile. So we must use the web of determinants to help us to understand for each player which will be the relevant variables and the interaction between them that will simplify the prevention program. So I cannot do everything. I must do the key points, the key combination for each player. And of course, this is not easy. So we can work in a very global way for the group way, but also we can identify, since we are assessing and we are monitoring, what the needs of each player. And we can do that in a simple way, in a very easy way, in a routine way, that some athletes will do a specific exercise, isometrics or eccentric, based on their assessment. So for example, how can we and how we are using that in a daily basis? So when we have a match, we do match day +2 assessment. So I've been doing that for the last 4 years. In different ways. So if you have a Nord board, you can use it. If you have an isometric dynamometer, you can use that. So this is the second figure here in this very nice paper published in 2015, and also an editorial published in 2019. So I use this flow chart in a daily basis. So we are having very good results using that. So when we have 2 days after the match, if we have isometric asymmetry more than 14%, we usually reassess the next day, and also we do some isometric in an asymmetric way. So we do some exercise for the weak leg, the weak hamstring, also using isometric because we don't want to fatigue more this muscle. And if the player has pain or he has a different clinical presentation, we will do ultrasound, for example, and then also thermography, and then we can understand more about what is happening in this hamstring. And if there is a training session that day, we will talk with the coach, and this specific player will not do high-speed running. So this is a very key point, and because doing that, the player can train and also can recover from the match 2 days before. So the next day, when we have a different match, the player will be recover from that. And we are doing that, and the results are amazing. And I'll show it to you. So this is our dashboard from last year, from Cruzeiro, that showed us how we monitor the player after the match. So the first thing here in this wave shape, we have the hamstring isometric results. So here we can see the asymmetry, but also we can see the absolute decrease of the strength. So during the asymmetry or the normal results, we can compare if the player is bilateral weak or there is a mismatch or an imbalance between the legs. So we also watch and we also pay attention for absolute values and also relative, which is the asymmetry. And also we assess counter movement jump to see the overall neuromuscle state, the fatigue state. And we use a combination of the subjective rate that the player said if he is already recovered or not. So this is our dashboard, is a combination of different tests and also the subjective way of the player is saying about his recovery. So this is really nice because in 10 minutes, we can have all the results, and also we can show to the coach which adjustment he needs to do in the training session. Okay, so I'm really proud of that because we developed in a very Brazilian way, in a quick way, in an easy way, not with a lot of money cost, and of course having smart people around everyone. So our results are very impressive. I've been monitoring the results since 2018, and as we can see, and I've been working in 4, 5 important clubs, football clubs here in Brazil. So overall, we have these results. 50% less muscle injuries in youth football players. We had last year and this year 120 days without hamstring injuries in elite football, and also 40% less days of time loss, which means that we have been doing better rehabilitation process. And of course, I'm really proud of that. In all clubs that I've been working, I'm really I put a lot of effort in that, because I really believe this is a part of the prevention, because it's the secondary prevention, and with amazing 10% re-injury rate. And we are doing this in a very strong process, because we believe that if we do a very good rehabilitation process, we can improve athletes' physical response too. So it's not only rehabilitation, it's also training during injury, okay? So thank you so much. And the final slide is that the take-home message, I really enjoy this. It's a publication from Budetop and also Della Villa, Francesco. And we can see here that our overall recommendation for hamstring injury prevention. So I really enjoy this framework. So the important consideration will be, of course, analysis of risk factor and planning the program, also doing in an individual way, and having this holistic and global prevention, and not only look directly to the hamstring, and also think about the hip, about the foot, and about the whole biomechanic. And of course, gain the buy-in of everyone, from the director, from the coach, and also from the players. So that's it, and thank you so much. I'm really happy to be here with you all, and I hope you enjoy, and I'm here open to all the questions and have a nice conversation and discussion about this topic. Thank you so much.
Hi, Natalia. How are you?
Hi, Mario. Can you hear me?
So we see you, so it's not the slide.
Yes,
we need
it's
so
me.
the tone, maybe?
Yes. Thank you so much, and congratulations. Amazing Congress.
Yeah, congratulations to you for all your work.
Thank you. Hi, Suzanne.
So I will say if there are any questions. You're happy?
Yeah, we have a question from the audience. By secondary prevention, do you mean before injury or no? I guess not, or?
After injury?
Yeah.
When we have an injury, if we do a very good rehabilitation process, we'll prevent a second injury or a re-injury. So it's part of the secondary prevention.
Of course.
And it's also part of the physical therapy process too.
Good.
So waiting for some other question, I will address you maybe one question. So can you maybe explain or tell us a little bit how is the composition of your staff now working at Clube Bahia?
Thank you, Mark, for the question. So nowadays I'm working with the multidisciplinary team with doctors, psychologists, 4 physiotherapists, massage therapists. Also, we have physiology, head of performance, which is the first physical coach, strength conditioning coach. And also we have a player care. It's a person who takes care of the player and his family. And also a performance analyst. So it's a huge department with 30 people around, and I am the head of everyone. And it's a big responsibility, and my work right now is trying to bring everyone together to work in a multidisciplinary way to improve athletes' performance and decrease injury risk. So at the end of the season, we have only 4 matches to go. We are really happy with our results because we have players with better body composition, stronger, faster, and with low risk, injury risk. So this is the final results of the big season we have here in Brazil with 5 matches around the whole season. It's too much.
Also the reason why you are not here today, but we appreciate your time. I think there is a question from the... Yes, please.
How you measure counter movement jumps in a cheap and accurate way?
So today we have vowed system, so it's not the cheapest one, of course, because since we are part of the CFG group, we have the vowed system for all the clubs, so we are using this right now. But yes, last year we were using the jump, how can I say it? Jump contact.
Platform.
It's not first place, it's a jump plate. It's different because it's only takes the jump high, so it's not force plate, but it's only a small contact, a jump platform. It's jump platform.
Okay. Thanks.
Thank you.
Okay, then I ask my question. I just downloaded your app during your speech, and then I come to the end, and it cost $12. But I wanted to ask is if there is also a button for English or German or another language. Yeah.
Yes, it is in English and Spanish, and I think we finished the Italian version.
Okay, then I ask my Brazilian patient. Okay, thank you.
Thank you. I hope you enjoy.
I have a question. You mentioned you measure acute and chronic workload. The last 4 weeks and the last week, which stats do you measure? Like, is it RPE, training volume? Which measures do you use to calculate this?
We used to have high-speed running is the main variable that we use to connect with internal workload. So we use external workload with internal workload. So today I think the best way to understand how athletes are respond to the external load is to connect both information. So I think this is the top level information that we could have. So for this purpose, we use high-speed running, acute and chronic, and it's not a fancy statistic. It's the easy way that our physiology wants to have this connection. But of course, we are now implementing a statistical and more deep understanding of acute chronic. But for now, we are using the basic one.
Okay, thank you very much.
Thank you.
I have one more question from the audience. Could you maybe repeat for us the criteria you use to adapt practice after isometric test? And do you know something about similar for the maybe groin adductors, I guess? You know, the test, how do you adapt? You do the isometric test, and if the player has pain or, you know, or you assess it with the ultrasound, I guess. Could you repeat that?
Oh, yes, this is my favorite part because I love doing this monitoring after the match day. So we used to have the match day +2. We do the isometric for hamstring. And then if the player has 14% asymmetry, we have this player, and then we do ultrasound thermography and also a clinical assessment to see and to check if he has any pain. If he has any pain or there is a different image from the thermography, we will take him out of the training session and start doing an early rehabilitation process. If the player has only asymmetry without pain, we will allow him to train, but not doing high-speed running. So this is the key point, because I love this, because it's a small adjustment in the training session, because I don't like to take out the players from the training, because training is good for them. So if we could only have this adjustment with the coach, it's amazing, because the coach will increase the reliability with you, the confidence to have this action. So it's a way to improve the relationship between the coach and the multidisciplinary team. So we've been using that, and we have good results, because the next day when we recheck and reassess the player, the asymmetry is low. So it's low, it's under 10%. So we could give the player back to the training session or the match, because sometimes here in Brazil we have 3 days only between one match and the other one. So it's a really challenge calendar, and it's a very congested calendar.
There is one more question in the middle of the room there.
Hello, everyone. Actually, it was my question on Slido. You talked about the asymmetries. Did you also assess, like, the week ago, if you have, for example, differences more than 10%?
Sorry, I don't know if I understood. So you want to...
So do you watch only the asymmetries, or also like if you have worse results to the baselines?
Okay, good question. So we analyze both. So if the player doesn't have asymmetry, we also analyze the comparison between the baseline and the current value. So if the player has less than 20%, or more than 20% or 50% less than the baseline data, we'll have some exercise to improve his hamstring values. But usually on the second day, the next day from the assessment, we will see a normalization of these values. So I liked your question, because the asymmetry is a key point, but also we could have both sides decreasing strength, but it's not a big alarm for us. So we intend to monitor and see how the player will be in the next day. So in this case, usually we don't take out the player from the training session, but we use to intensify the recovery for hamstring muscle.
Thank you.
Thank you. Good question.
Great. So we will have one more question. There was a topic that came up during the day, also the role of education, dialogue, communication. Maybe can you tell us something about, considering you moved from Cruzeiro, then you came to Bahia, new situation, new club, maybe some differences with young players versus more senior, experienced players? How it went, the process?
Yeah, I love this question, because I think communication is one of the important pillars in sports physiotherapy, and usually we don't take any attention for this, and we only learn from our experience, because we don't have this in books and also papers sometimes. And communication is vital. So right now, the first thing we start doing is talk and educate the players around our protocols and our process. In the beginning, they were claiming all the time, I don't want to do the test. I don't know why we are doing this. And we are keeping doing this. Like, consistency is the key for communication. So we start doing communication, and the next time we do the same thing, and the player stop complaining, because he feels that the communication is the same between all the multidisciplinary staff, because the players, they are really smart. So they talk with the doctor, they talk with the physio, and they talk with the psychologist, and they test if we are saying the same thing. So before doing the whole communication with the player, first we need to communicate inside the multidisciplinary team. So everyone needs to be part of the whole protocol and say the same language. So I'm in charge of that. So all the time we do multidisciplinary meetings once a week, sometimes twice a week, to get all the communication aligned between all the members of the multidisciplinary staff, and also communicate the same information to the players. So this is the key point. And I think physios need to improve their communication skills. We are not so good. I think we need to improve that. And even saying the same language that the players and also the coach. So we need not stopping talking about physio language, but we need to translate our language to the player's language and the coach language. So we need to have both dictionary, if I may be clear about this, and improve our communication skills to get the athletes understanding about everything we are doing, and even showing them the data and showing them the progress. I think they love to see how they are improving over the season and how is the match impacting his body. So I think this is a very important key point in our whole process: educate and communicate.
So some great points, Natalia. So here we have to come to an end. So I will say, how is Bahia doing at the moment?
On the pitch?
Yeah, on the pitch. Ranking, ranking.
So this is the key point, Mario, because sometimes everything
It's all
is
about the
going fine.
results.
Yeah, with the multidisciplinary team, but on the pitch, it's not doing so well. So right now, we have 4 matches to go, and we need to win all the 4 matches. Otherwise, we will relegate to the Serie B, which is not good for us. So this is something that we need to handle, because it's frustrating. Sometimes everything is amazing. We don't have injuries, but the players also are not scoring.
Yeah, that's
so, of course,
that's sport. We have heard from the Rugby World Cup as well. But we wish you all the best for the last 4 matches, and keep on the great work. And many thanks that you were taking some time for us today. And
Thank
see you
so
soon.
much. I really enjoyed to be here. Congratulations for your Congress. Thank you so much. I'm really honored.